Hey Summer, you have a really good grasp of the health security field and what we're trying to do. And I was wondering if you could talk a little bit about what you've experienced with the Center for Health Security and Response Readiness and what you've seen in that interplay with the professionals as well as your current academic pursuits.
Yeah, I think the academic curriculum set me up to be able to actually engage with real-world practitioners in a way that a lot of students struggle with in the beginning when they enter the workforce. So having that background knowledge of not only what they do, but the struggles that they deal with and the challenges that they undergo on their day-to-day helped me gain a better understanding of what I need to do in my practice at the Region 6 Center.
So you've been in New Orleans for a while now. Can you speak a little bit to the advantages of studying a degree like health security in the city of New Orleans, such a vulnerable city to a lot of the extreme weather events and other big mass gatherings?
Yeah, I think there's just so much here. I mean, culturally is its own thing, but academically speaking and professional development speaking, I think there's just a wealth of opportunities. You're almost immersed in health security, no matter where you're at in the classroom or walking the streets. We have flooding, we have outbreaks, we have all of these different things, and we have such close ties to the local health department and the New Orleans Office of Homeland Security and Emergency Preparedness, where you can get more involved and actually apply what you're learning in practice.
And that's a great segue. You've done a lot of work outside of the classroom and outside of the Tidewater building here at Tulane. What are some of those immersion experiences that you've been able to take advantage of?
Well, for instance, I was able to intern with ViaLink, which was, it runs the 211 system for Louisiana. And there, during the COVID pandemic, I developed a social determinants of health dashboard, things like housing and food needs during the crisis. And that dashboard was able to help target resources around, I think, 9 parishes in Louisiana. I was also able to intern quite extensively with NOSEP, the New Orleans Office of Homeland Security. And there I was able to work on the city evacuation plan and work with volunteer management. I was actually in the Emergency Operations Center for Hurricane Zeta, which it was an unforgettable experience, truly. And work on the mass vaccination campaign plans for the COVID vaccine rollout. It was great.
That's outstanding. I'm glad you brought up the New Orleans Homeland Security Emergency Preparedness Office. Someone from the City of New Orleans Homeland Security Emergency Preparedness Office has actually been a graduate of the School of Public Health and Tropical Medicine from 2005 to 2018 in leadership roles there at NOSEP. So it's a really strong connection. We like to keep that connection as strong as possible to allow not only opportunities for the faculty and the centers to get involved with assistance, but to provide that immersive experience for our students to continue to learn and lead in that capacity.